Yeah, whatever you like. All right, well, I'm Dr. Michael Twyman. I'm a cardiologist. I'm the heart attack prevention expert in the area, and for those who know my brother Jeff, he's a firefighter in St. Charles City. So I have firefighting family members. My brother, my dad used to be the chief over in Collinsville and then over at JPL at NASA before he retired. So I know what you guys go through. And I know heart disease is also very prevalent in the fire service. So 50% of the kind of line of duty deaths are going to be from a heart attack. So it's my goal to try to give you guys some education today that can hopefully help reduce that risk for you. So, born and raised in St. Louis, did all my training down at SLU, went to the Navy for 4 years as an internist, and I have about, 4 hours of firefighting experience when I was in the Navy during my officer indoctrination school, which is like a fork and knife club. It's not like crazy boot camp like the Marine recruits are, but they had us on a mock-up of a ship that was on fire, and we had all the full turnout gear on, and it's doctors and nurses trying to put the ship out, and we're like, we are screwed if the boat is on fire, and it's the docs putting the fire out. So I had the experience of being in some of the heat, but nothing like you guys actually do. But finished my Navy training, went back to cardiology, and initially thought I was going to be more kind of a cath lab person, and cath lab is an exciting place to be to stop heart attacks, but I ultimately got interested in trying to help people prevent them in the first place. So that's what I've been doing for the past 7 to 8 years now. And recently, about 3 months ago, I went out and started my own practice, Apollo Cardiology. It's located downtown Clayton. So I work with patients locally, but also trying to work with patients nationwide, utilizing telemedicine. And I have a special place in my heart for the fire service because I know what you guys go through, and I want to try to help the younger people not end up in the offices of my colleagues or end up in the hospital with the vents. So today we're going to talk about a couple tests you can get that will screen you at an earlier stage than you're probably used to, and then kind of my 4 pillars or 4 legs of a stool, things that can help you really reduce your risk of having a heart attack or stroke at an early age. So everybody's probably here had their blood pressure checked, their blood sugar, their cholesterol. You know if you smoke, you know if you're overweight. Those are kind of the big 5 things that might contribute to heart disease, but honestly there's about 300 to 400 things that contribute to heart disease. And you don't always test for them all. So I try to do a little bit more testing to try to find people at an earlier stage than when they end up in the hospital. 50% of the time when somebody comes into the hospital with a heart attack, they had no symptoms until they had the heart attack. Stress tests are really good if you're trying to recreate somebody's symptoms. They're having chest pain, shortness of breath, something when they're exercising. That typically means you probably have a 70% blockage in one of your 3 heart arteries. But you can easily pass a stress test and still have a heart attack because you have subclinical plaque building up in your arteries. And that's where I kind of recommend 2 specific imaging tests. One's probably more important than the other, but both are important. The test I always recommend for anybody over the age of 40, or if they have significant risk factors for heart disease, is called a CT coronary calcium score. It's a low-dose radiation CT scan that's evaluating if there's any calcifications in your heart arteries. It was like a mammogram for the heart. You want to find stuff at an early stage. This test is about $100, takes less than 5 minutes to do, no IV, no contrast, and it'll tell you do you have calcium building up in the walls of your arteries. Calcium in your arteries is a bad sign, it means plaque is building up. Calcium is supposed to be in your bones and teeth. The higher the score, the higher the risk. So if your score is 0, the risk is theoretically 0.4% of having a heart attack or stroke over the next 5 years. If your score is 100 to 400, intermediate high risk, over 400 high risk, over 1,000 very high risk. Over 1,000, there's a good chance, not that you quote need a stent or bypass, but it's very likely you're going to have some severe plaque in your arteries that needs to be seriously addressed. That test, like I said, takes about 5 minutes, and there's multiple locations in St. Louis that offer it. When I came to talk to some of your other guys, a couple weeks ago, I know the chief was looking into seeing if they can even get that test covered for you guys. So if you take nothing away, that's probably the biggest test I would consider getting done if you have any type of risk factors. Get that test. If your score is 0, pretty much keep doing what you're doing. But if your score is higher than that, you may want to see somebody like myself or a doctor to kind of get to the root cause of why you're developing plaque at an early age. Second test that I typically recommend, and it's just coming online in my practice, called the Carotid Intimal-Medial Thickness Scan, or CIMT. It's an ultrasound of your neck arteries. It's not necessarily looking for severe plaque, but it's looking at the thickness of your arteries. The thicker your arteries, the more soft plaque is likely building up. And this test will give you a vascular age. So if your vascular age is older than your biologic age, then you probably want to do something about it. If your vascular age and biologic are the same, then you're probably not doing a whole lot of damage to your system at that point. And then after those two tests, I typically recommend a fairly comprehensive blood work panel. I know you guys do some of these panels where you're getting more testing of inflammation. I tell people inflammation is like the fire in your arteries. Cholesterol by itself is not bad. Every cell in your body needs cholesterol, but if your arteries are on fire and cholesterol is going there to try to put the fire out, not just to put the fire out, but it's trying to repair the damage that the fire has done to the walls of the artery, the cholesterol itself then gets damaged, and it's that damaged cholesterol that gets stuck in your arteries and starts forming plaque and keeps building up unless you shut off the fire, shut off the inflammation. So I have a fairly comprehensive blood work panel that checks about 5 or 6 different inflammation markers, checks specific lipid particles that actually transport the cholesterol around your system. Those are more important than knowing what your actual cholesterol numbers are. And there's some genetic markers you can see. Did you inherit certain things that put you at higher risk? So those are kind of the 3 quick rundowns of things that you should consider doing if you really want to know, are you low risk of a heart attack or are you higher risk of a heart attack? Now I'll transition into kind of the 4 things that you can do that are not necessarily pills and procedures. You know, I've trained in conventional cardiology and I can still do that as needed, but it's much more interesting to me to try to help people never end up needing the pills and procedures. So, you know, there's 4 things that are important for optimal health. It's, you know, how you fuel the system, how you move the system, how you deal with stress in your system, and then how you sleep. And I'll save sleep for last because honestly I think it's probably the most important of those 4. So first off, how you fuel the system, how you eat is very important, but it's not the number 1 thing. There's these things in your cells called the mitochondria. Those are the things that make energy for you. They're your engines. So you can put in premium fuel into your system, good food, organic food, whatever you consider good food, but if your engines don't work, it's not going to burn it appropriately. You're not going to get the energy output that you want. So you got to kind of focus on the mitochondria, and the things that can help that are what we're going to be talking about: how you time your meals, how you move your body, how you sleep optimally. You're tuning up your engine so that you can burn the good fuel that you put in the system. So I'm not a zealot on, there's a perfect diet for every single person around the world. It really depends on where you're at in the world at that time. So I'm a big proponent of seasonal eating, meaning if it's growing in your local environment that time of year, you should probably put it in your system. So the diet that's in St. Louis is different than the diet that's on the equator. On the equator, bananas are growing 24/7, 365. If it can grow there, the sun grew it. And you should be able to put it in your body at that time. You can think of it as, the sun is growing the plant, or the animal is eating the plant, you're eating up stored up sunlight. So your body is decoding the information that you see in the environment. So if you're eating blueberries in January in St. Louis, your body's sort of like, the sun can't grow this here, how did this get in my system? And that causes an information mismatch in your system. So in St. Louis, you're probably eating more fruits and veggies optimally in the spring, summertime, and now the fall you're getting into kind of the squashes, potato type stuff, but then in the winter, there's not a lot of vegetables and fruits growing in St. Louis. So that's the time of year you're more ketotic. So if you've heard of the keto diet, the keto diet can work, but it optimally works when it's colder in St. Louis because there's not a lot of sunlight growing the food you would normally eat that time of year. The other big thing I talk about with my patients is time-restricted eating. It's not starving yourself, it's just time shifting of when you actually eat. And we'll get to these classes in a minute because it's really about your circadian biology. Your circadian rhythm is your 24-hour cycle, and the 24-hour cycle is kind of programmed by 2 things. It's the light environment that you're exposed to and the timing that your meals come in. So even if you don't change up what you eat, if you change up the time you eat, you'll likely get a health benefit. One thing is you'll likely lose weight if that's your goal. You'll improve your insulin sensitivity so you won't become pre-diabetic, or you could reverse diabetes if you're already diabetic. And you'll actually sleep better. You'll get more deep sleep, and that's when your body repairs itself. So time-restricted eating, there's a good book on it called The Circadian Code by Dr. Panda. Most of the data is in mostly rodents, but is applicable to humans. So the take-home is basically try to eat all your food within a 12-hour window or less. So whatever time you wake up in the morning, the first thing you put in your mouth that is not water starts the clock for your liver and gut, figuratively and literally. 12 hours after that point, stop putting anything in your system that isn't water. Your body would like to have 3 to 4 hours of nothing coming in the system before you go to bed. kind of shuts off the molecular machinery in the liver and gut. No more deliveries are coming in for the day. And then while you're sleeping, your body can then package up all the good stuff that you're putting in the system into the proteins and the things the body needs to make overnight. If you're eating up until the moment you're going to bed, your body needs 3 or 4 hours to flip that switch, and it's probably going to be midnight, 1 o'clock before you're now into kind of fat burning mode. So if you're really trying to lose weight or optimize your body composition, the earlier you can finish your meals, the better it will be. Honestly, the hardest part of it is really the social aspect. You know, you're used to going out with buddies or whatever, and you're eating 8, 9 o'clock at night. You can do that once a week, but if you can 5, 6 days a week, pretty strict on finishing up, 6-ish, 6:30, depending on what time you wake up, you'll notice a health improvement. We'll get into the exercise in just a moment, but people kind of know the details that there's good carbs, good fats, bad fats. Not really. It sort of depends on what your health goals are and what is quote bad or good. But one thing that's frequently not always explored is the quality of protein that you put in the system. And this isn't a plant versus a animal source protein, but you need protein to fuel the muscle growth. There's 2 things that make your muscles grow. It's resistance strength training and the timing that the protein comes in the system. There's a physician that I've been following, Dr. Gabrielle Lyon, who works with special forces. She works with high-level executives. She practices something called muscle-centric medicine. She trained at WashU. So I've been following a lot of her data about her protocols of timing your proteins. I try to implement that into my own system. So the barest minimum is you want to shoot for 30 grams of protein 3 times a day, because that protein causes your muscle protein synthesis to kick in and maintain your muscle. I don't remember the exact date, but probably about 35, 40. If you're not doing some type of resistance training as you age or strength training as you age, you're going to lose about at least a half pound of muscle a year. And your muscle is your metabolic currency as you age. Your muscle is what burns your sugars, what burns your fats. If you don't have muscle mass and you're frail, you tend not to do well when you get sick or injured as you age. And if for anybody here who knew my brother, recently had an event where he was in ICU for about 5, 6 days. Fortunately, he's making a full recovery and he's back to work now. But if he wasn't as healthy and muscular as he was, he might not have got out of the ICU as easily as he did. So nutrition's important. Now we'll talk about movement. So some are cardiologists, but I'm not going to stand up here and tell you cardio is the best exercise for you. I'm actually going to tell you resistance or strength training should be your fundamental, and then you bolt on the cardio, the flexibility, whatever else you'd like to do. So resistance training, I'm not an exercise physiologist, but you should be probably doing some type of resistance or strength training 2-3 times a week for your big muscle groups. Whatever type of exercises you like. Start with body weight if that's all you really can do, but then work with a trainer, somebody who knows how to lift weights and get shown how to do it, because the more muscle mass you have, the healthier you tend to be as you age. And as for cardio, the only thing I would say about it is, if you're healthy enough, you probably should be considering doing some type of interval training, because interval training is more physiologic and that helps probably boost your metabolism for a longer period of time than doing just steady state cardio. It would not be evolutionary beneficial for you to go out there and run 26 straight miles at a pace of 8 miles an hour. Your body was never really designed to do that. You can do it, but that's not necessarily the adaptation that humans were evolved to do. There's a wild animal, go chase the wild animal, you slow down, you chase, you run, you stop. It's just stop and go. That's what interval training is. And there's different forms of it. I mean, I did some interval training this morning before I came. It's basically go all out for 20 seconds on whatever modality you like, run, elliptical bike, then dial it back to maybe, 60, 70% of your maximal for about 3 times that length, so about a minute. Let your heart rate recover and do it over again, and shoot for anywhere between anywhere between 7, 21 minutes. I mean, if you can go 21 minutes easily, you're probably not pushing it hard enough at the initial part of it. And it kind of goes into a side note, I remember somebody in one of the prior groups was like a marathon runner. Running marathons is a skill. It's not necessarily the thing that is most heart healthy long term. If it's one of your life's goals to run a marathon, well, go run the marathon. But the challenge with marathon running and all those kind of ultra endurance sport endeavors is that if you don't give your body time to recover from that damage, your body will be inflamed as you're trying to repair it, and your arteries are kind of damaged as the innocent bystander. So as long as you train hard and you recover well, you may not be doing that damage. So I have a couple patients in my practice that, they're marathon runners, and, they think they're the healthiest people in the world. We do the calcium scan, and they got a significant amount of plaque in their arteries, and they're like, well, how did this happen? It's like, it's possibly because you're inflamed from overtraining. So, and then we also do the blood work to try to figure out if there's any other hidden reasons why they have the plaque. But if you have marathon friends, it's a good skill, but don't think it's the most heart-healthy thing to do for yourself. We'll move into the stress component, stress relieving techniques. What you guys do is stressful. I know. I mean, I was on call for many, many years. Middle of the night, wake up, it's go time. The tones go off, and you go from 0 to 100. That's the fight or flight response. That's your sympathetic tone going in overdrive. Sympathetic tone is needed. You need your pupils to dilate. You need your heart rate to jump up. You need your muscles to be fueled so you can run and go do what you need to do and get away from the saber-toothed tiger. But when that kind of go time is over, you want your parasympathetic tone to kick in. That's your rest and relaxation part of your autonomic nervous system. So you're always between the balance between the sympathetic and the parasympathetic nervous systems. So parasympathetic is the rest and relaxation, or rest and digest. So when you eat, the vagus nerve is stimulated, heart rates are slower, your body's trying to repair itself at that stage. So meditation is always good if you're in meditation. I do it personally, but beginners sometimes find meditation hard because you don't get that instant feedback. Is it working? Deep breathing exercises are good. You always have your breath with you, so I usually teach my patients about box breathing. So you got that fight or flight response. You feel like your heart's beating out of your chest. If you can take a few deep breaths, you can kind of pull that sympathetic tone down and bring up that parasympathetic tone. So teach patients the box breath. It's 20 seconds long. It's 5-second breath in, hold for 5 seconds, blow out for 5 seconds, hold for 5 seconds, and do it again. So 20-second cycles. Try to do it 5 times. And then from a tech standpoint, I tend to recommend a device called the HeartMath. It's made by a company called Inner Balance. Plugs into your iPhone, looks like a pulse ox, clip it to your ear. It's measuring your heart rate. It's also measuring your heart rate variability. Your heart rate variability is the beat-to-beat difference between each heartbeat. So if you're the ones who know how to look at an EKG, it's the R-to-R interval, how it's changing. So your heart rate should not be 70, 70, 70, 70, 70. It's you breathe in, your heart rate expands, you breathe out, contracts. The further it can expand is the better your heart rate variability is. That's a good marker for overall cardiac health. If you have a very narrow heart rate variability, it's a higher risk of sudden cardiac death, and it's from an exercise standpoint, it may be a marker that you're overtraining. So many athletes will use heart rate variability measurements first thing in the morning, pick a baseline for many days and see what their number is. Go push it hard one day, see what your number is the next day. If your number is staying the same or getting better, okay, you can keep pushing it that day. But if your heart rate variability is getting worse, you probably want to take a lighter day or take a rest day. But the Inner Balance device or HeartMath device has a little app, has a little ball going across the screen, and you do the deep breathing exercises with it, and you're getting instant feedback by colors. If it's red, things are out of balance. Blue, and then you want to be in the green. If the more green, the more coherent your brain and heart are talking, the more likely your autonomic nervous system is in balance. And lastly, we'll talk about sleep, because sleep is something that is a big issue in the fire service, I know, because I've talked to my brother enough times. I know that you probably should put CPAP machines in every single bunk room, because probably half you guys either have sleep apnea or know somebody who has sleep apnea. So sleep is when your body repairs itself. So earlier when I was talking about the mitochondria, that's the time that the mitochondria rebuild stuff that's been damaged throughout the day and get rid of the stuff that needs to get rid of. So if you don't sleep well, it's very hard to live an optimal life. I understand, when you're at work, your sleep is going to be interrupted. When you're at home, try to focus on having optimal sleep. So it's more important to get quality sleep than it is necessarily the quantity. All comers, maybe about 6.5 hours is probably, quote, optimal sleep. But those are people who are very healthy and recover quick. If you need more time to sleep, it just means you probably broke yourself down a little bit more the day before, and you needed that time to recover. So it's not a competition, who can sleep the less. It's just how well do you feel when you wake up in the morning. So usually tell my patients, when you wake up in the morning, give yourself a scale 1 to 10, how well you feel. If you feel like you could go out there and wrestle a bear and feel awesome, then you probably slept well. You feel like I could lay in this bed the rest of the day, you probably didn't get that deep restorative sleep. And you got to figure out what did you do the day before that thrashed your sleep. I'm not currently wearing it, but I wore it last night. There's a ring called Oura, O-U-R-A. It measures your sleep quality. It tells you what time you fell asleep, what time you woke up. It has that heart rate variability, has your temperature, and it also has like Fitbit stuff where it has your steps and all that. But I use it mainly just for the sleep tracking. It's very easy for me to be able to tell myself that, like, okay, I didn't sleep well. What did I do yesterday that messed us up? One of the things is if you eat too late, you eat at 10 p.m., put your head down, your deep sleep is going to be impacted. If you drink alcohol, you kind of thrash a little bit of your REM sleep. So yes, you're sleeping, but you're not dreaming, and you're not getting that time when your body consolidates memories. So tracking your sleep is probably important if you want optimal health long term. Things that can help optimize sleep that aren't pills are setting up your sleep environment. So I tell people they should try to have a sleep cave. You want to have somewhere where your body can regenerate. So your bedroom really should be for two things only: sleep and sex. You don't want to be reading in your bed or watching TV, because that conditions your brain that there's other things to do when you're in this bed. You want to think of bed as something where your body's repairing itself. So set up your bedroom in a relaxful way, whatever that means to you, but it should be dark. It should be so dark that you can't see your hand in front of your face once all the lights are up. So if you have blinds, invest in a pair of blackout curtains that can kind of turn off everything that would be shining on your body. So you may have your eyes closed. You don't want your body being exposed with light, because there's certain receptors in the body that will tell it, hey, it's morning time. Wake up, start making hormones a different way. Start raising cortisol, the alertness hormones. So dark, cool, ideally probably 68 degrees or cooler is where you'd like it to be. If you're into doing cold showers or cold thermogenesis, it is not that bad of an idea to do about an hour before you go to bed. You dip your temperature at nighttime. That's one of the biggest inducements for going to sleep. First, I notice I get a lot more deep sleep if I do the cold therapy stuff in the evening time. Back to the light, I'm wearing these glasses because these glasses filter out a certain spectrum of light from your overhead lights. I want my circadian rhythm to be timed by what I eat and by how I'm exposed to light in the natural environment. So evolutionarily, we were designed to go outside in the morning time. You would see the sunrise. The sun would enter your eyes without glasses on. The sun turns on certain receptors in the front part of your brain, and you make hormones throughout the day. You make your testosterone early in the morning. If you miss the morning sunlight, your body kind of has a mismatch in the clock in your system. So you always can think of the sun as kind of the GPS resetter. So every time you're outside in the sun is telling you by the color of the sun and the position in the sky what time of day it is to your body. This is how you make your hormones and neurotransmitters this time of the day. So if you see the sunrise, you set up the clock for how you make your hormones, you'll typically start getting tired 12, 14 hours after that period. Then anytime I'm inside in front of a computer or a lot of artificial lights, I wear these because these block out that blue wavelength spectrum that is very energizing. So the sun has blue light, but it's balanced by red light. That's fine. This is stuff overhead is 4 to 5 times as intense as the sun from the intensity spectrum. And that light will basically tell your brain it's July, it's noon, stay awake. So if you're on your devices at night or you're in front of a lot of artificial light at night, the brain's stay alert, stay alert. So sometimes people will be able to fall asleep, but it's really hard for them to stay asleep because they thrash their melatonin hormone. Some people here might have taken melatonin as a hormone or supplement before, and it can help with jet lag, but it's probably not recommended that you take it routinely because it's just a marker that there's something bad going on in your environment if you thrash your melatonin levels. And earlier when I was talking about the mitochondria, it's the melatonin that actually makes the mitochondria regenerate themselves at night. It's the melatonin is also the antioxidant, prevents your cells from rusting. So you protect your melatonin by protecting your eyes from the artificial light. Instead of just the glasses, there are things you can put on your screens. iPhone has the night shift mode, Droid has their own version of things. There's a couple of apps you can put on your computers. One's called F-Lux, one of them's called Iris. You can dial down the intensity of the blue light or the bright white light that comes off your monitors at night. when I mentioned your sleep cave, ideally the room should be as dark as possible. If you need a night light for, got to use the restroom at night, try to use like an amber or red bulb. That won't affect your melatonin levels while you're trying to be restorative in the dark. So those are my kind of 4 main things: is how to focus on your nutrition, how to move your body, how to deal with your stress, and then how to optimally sleep. My call to action is that if this has been beneficial to you, share this with your friends. If you're interested in any more information, I'm on Instagram at Dr. Twyman, Dr. Twyman. You can follow me there. I put a lot of this content up there routinely. And if you have family or friends who need a cardiologist, I'm happy to see them. So thank you for your time and attention today, and I'll open up to any questions you guys have.
How do you spell your last name?
T-W-Y-M-A-N.
That's the Instagram name?
It's just Dr. Twyman, Dr. Twyman.
What was the name of the circadian book that you said?
The book is called The Circadian Code, and it's by Dr. Panda, like the animal. It's a good book. There's also the Audible version. I've gotten into reading many books this year, but I also like to do a lot of Audibles because you can put them at 2x and get through a book in about 2-3 hours.
You talk a lot about like reducing inflammation. Is that just a combination of all those 4 things, or is it specific foods you eat, or what?
It's a good question. Inflammation is something that is beneficial to you when it's acute. So if you get injured, if you have an infection, you want your immune system to come on, make all these inflammatory cytokines and other chemicals that go out there, kill the bacteria, kill the virus, and then the immune system shuts off. But if your immune system's always turned on, the blood vessels are carrying these cytokines and other chemicals through them, there's more risk that the blood vessels themselves are getting damaged by that inflammation. So there's multiple things that can damage the arteries from inflammation. Sleep is one of them. If you have sleep apnea, you're stopping breathing, you're putting a lot of stress or strain on the heart, that's one of the things that will definitely increase inflammation. If you don't sleep well at all, you're going to have high inflammation because that's when your body's clearing most of that stuff. Exercise is a good way to clear inflammation, but it's targeted. Exercise is a drug in ways. None is not good and too much is too bad. So there's somewhat of an exercise dose. So if you do too much, again, like the ultramarathoning, that's probably going to be more on the pro-inflammatory stage. Nutrition-wise, there are foods that are more anti-inflammatory than others. One of the best things is trying to get enough omega-3s or seafood in your diet. The omega-3s are very important, especially the DHA component of omega-3s, because it's very important for brain health. And DHA is also one of the things that helps your body transfer energy from your environment and gets it to your cells. It's like the conductor. So the more DHA you have in your system, the better the energy gets pushed into the mitochondria, the more energy you have to run your muscles, your brain, whatever you want your energy to run. So, but inflammation, first you got to go looking for it, and there's multiple blood markers to look for it. But sometimes people have symptoms of quote inflammation. Their joints are going to hurt, they're going to have swollen, red joints, or they just feel achy, or they got brain fog. That can be markers of inflammation.
You got this floaty pool thing on your Instagram. Does that really work?
Was that the salt water
Yeah.
pod? Those definitely work. Float tanks, there's a couple companies in the area that have them. I can tell you the first time you do a float tank is going to be the weirdest thing you've ever done, probably.
Yeah.
You're laying in this water that's the same as your body temperature, and after a couple minutes, you can't feel anything because your arms and legs feel the same as the water, and you'll think they've left you in there forever.
Yeah.
You have no idea how much time is passing. They call them sensory deprivation tank for one reason. So sometimes you feel like you've been in there 10 minutes, sometimes you feel like they've left you in there for 2 days. But if you have any ability to kind of calm your mind down, it's excellent for relaxation. There's, the way you float in this water is that magnesium salts. They got like 800 pounds of salt in, about this much water. So you're very buoyant. Your body will absorb a lot of this magnesium. Magnesium is a relaxation mineral. About 300 to 400 different reactions in the body require magnesium. So you soak it up over your skin. you'll notice you're gonna have a awesome nap that day, or you're gonna probably sleep much better that night after you do a float tank. So I use it more as a relaxation thing. Like I said, I've been meditating 2 to 3 years. You get into some of your deepest meditations when it's dark and there's nothing else to think about. Another kind of biohack way that I do it is, if you have a problem in your life that you want to try to figure out, it's not bad to jump in one of these tanks because you got nothing else to think about for 90 minutes. And usually by the time you come out of this thing, you'll have an answer to your question. But I typically will recommend, there's different versions of them. There's ones that kind of look like a eggshell or an egg. They're somewhat coffin-esque if you're afraid of enclosed spaces. And then there's some that are like bigger, like a bathtub. So, but usually if patients or people are interested, you can get an intro float at places for $40 or less mostly.
Do you have a favorite book on meditation on Audible?
Favorite book?
Yeah.
Not a favorite book. I typically recommend people, app-wise, start with Headspace or Calm, or there's also 10% Happier. All of them, I should have some type of free version where you get to do a couple ones for free, and then if you like it, then you can upgrade to their pay versions.
What's your opinion on just meat in general?
Meat in general.
Yeah, red meat, pork. I know a lot of cardiologists seem to be not a fan of meat.
So meat is a controversial topic sometimes, but I would say focus being on a qualitarian. So it's not a vegetarian. It's, the quality of your protein sources matter. So whatever you're eating, so whatever animal you're eating what that animal ate. So if that animal ate junk, you're getting the junk in there. So you don't want animals full of antibiotics and growth hormones and stuff that you wouldn't personally want to eat. So if it's grass-fed, it's wild-caught, it's likely to be much betterly taken up in your system. Back to the previous statement that you need protein for muscle protein synthesis. Well, animal protein is just more dense in certain branched chain amino acids than plant protein is. You can be plant-based, especially if you're younger. You're 20 to 40 and fairly active. You can get away with being plant-based on, from a protein standpoint. But as you age, it gets a little bit harder to get enough high-quality protein in your system to actually activate your muscles. And it's mainly you need the leucine part of branched chain amino acids to activate it. As for red meat, again, it's the quality that matters. There is a test that you can do on among blood markers that I routinely check called TMAO, or trimethylamine oxide. It's a test that basically tells you how well your body's breaking down carnitine, which is one of the components of red meat, eggs, and fish. It's something that's made in your liver, and if TMAO levels are high, it means your body's having a really hard time breaking down carnitine appropriately. High TMAO levels are associated with damaging your HDL, so your body can't take the cholesterol from the cells and bring it back to the liver to recycle it. And TMAO has also been indicated that it may damage the blood vessels directly. So as long as you don't have a lot of inflammation, the TMAO levels are normal, and optimally your omega-6, omega-3 ratio is closer to 4 to 1, meaning you're eating some type of seafood. The red meat part of it isn't as controversial, to me at least. Any questions about sleep? Yeah.
Quality of sleep has changed since being in the fire service, so I tend to be more tired during the day, but at nighttime, like you said, I have to sleep with a pillow over my head, dark in the room, wife snores, so I tend to wake up. It's like clockwork. I wake up around 3 o'clock, 3:30 every morning, and from there on, I kind of sleep real light, because I don't want to get into a deep sleep, because I wake up like clockwork at 5 o'clock every morning.
That's extremely common, and it's one of two things off the top of my mind without knowing a little bit more of your story. It's there's you're used to being here and you're sleeping lighter because you don't want to miss a call and you're just ready to go. So sometimes it's really hard for people when they get out of this environment and go home to kind of switch back to the fully like, okay, I'm not going to get called tonight. I can get into that deeper sleep tonight. The other big thing is, and this is extremely common, is that it's the light environments that you allow yourself to be exposed to in the evening time. So if you're watching TV, you're on your phone, or you're just having a bunch of overhead lights on at night, your body's level of melatonin is going to be much lower when you're going to sleep. You'll be able to fall asleep, but you'll generally wake up about 3 to 4 hours after you fall asleep and have a real hard time going back to sleep. And melatonin isn't something that you can take that makes you sleepy. It just lets you get into those deeper restorative levels of sleep. So my recommendation would be that, invest in a pair of glasses like this, at least in the evening time. Maybe you're not going to wear these things in public like I do. I do it for effect sometimes just so I can educate people about blue light. But when you're at home, get a pair of glasses that the sun sets. Your body would have not been exposed to blue light at night normally. It would have only had campfire or candles. So get a pair of blue blocking glasses. A couple companies I recommend. One is called True Dark. This is what this brand is. One company is called Ra Optics, Ra like the sun god, RAOPTICS.com. And then, if you want to just play around to see if you even like the stuff, you can get them on Amazon from a company called UVEX, UVEX. They're about $10, but they're like safety goggles. They're like birth control. I mean, you would never wear these things out in public, but if you want to wear them at home to see how it affects you, they block enough light that it will have the circadian rhythm reset that you're wanting to look at. And then if those work for you, then upgrade to a fancier pair if you like to. But control your light environment at night, and then with your bed partner, earplugs and an eye mask.
Yeah, I was earplugging, but it lowers it, but
Yeah, and this was not uncommon. When I interview patients and they have their significant other in the room, I look at them and say, does this person snore? Do they stop breathing? And they shake their head yes. I'm like, we go get them tested for sleep apnea. They get tested, they get treated. Well, then the partner gets to sleep better because the sleep apnea is treated.
yeah, I recommend it, but
Yeah.
really push the issue. But that's more what I'm noticing now, but just the fatigue more during the day, but just being on a non-traditional sleep pattern. But
Right. And
I
then,
guess one thing that does help me is when I go to the gym and just go and stand on the side. That's my meditation.
Right. Yep. Yeah. Exercise is a big stress reliever for most firefighters and stuff. And then the one trick with the exercise is just make sure you're not doing it too late at night because you'll raise your cortisol levels and that'll keep you awake as well. The thing I mentioned is if you drink caffeine, 60% of people are slow metabolizers of caffeine, meaning it's going to stick around their system longer. So, for those people, the idea should be stop drinking caffeine probably 10 a.m., noon at the latest. Some people who are fast metabolizers might get away with a little bit later into the afternoon, but you want to try to shut off anything that's stimulating earlier in the day. Alcohol, like I said earlier, I'm not telling you don't drink, but be mindful of that if you're drinking alcohol. The later it is that you're drinking and then trying to go to bed, it's going to affect your REM sleep and it's going to affect the quality of sleep when you wake up, how you feel. Question?
Yeah, I haven't read too much on it, but there are studies that show that after our tones go off, we haven't exerted ourselves at all. We should do 10 minutes of cardio just to get that adrenaline out of our bodies and kind of spend it before we try to go back to sleep because of it causing cardiovascular stress. Is that a thing? Heard of that?
I haven't heard of it exactly, but it makes sense. I mean, your cortisol, your adrenaline levels are going to be jacked up like that. I mean, cortisol is there to keep you awake. The adrenaline stuff is to get your muscles and heart rate going and such. Evolutionary, that is beneficial. If you were injured out on the the fields, chasing the animals or whatever, you didn't want to bleed to death. So the high cortisol made your platelets sticky. You didn't bleed to death. You might be able to burn off a little bit of cortisol and adrenaline just by doing some push-ups, wall squats, something like that. But I wouldn't go hardcore exercise and then try to lay back to bed. But
Yeah. Okay.
Is there anything we can do? A lot of times, if I get 3 hours of sleep and get woke up, I can't go back to sleep here. What can we do to try and get back to sleep? Or should I just stay up? A lot of times I just stay up.
so that's a great question. It's I probably would recommend trying to do some type of breathing exercise where you're trying to really slowly breathe in and breathe out to kind of reset that balance. That heart math device is really good for it. I've on numerous occasions woken up and I'm holding the device in airplane mode and clipped in my ear and I fell asleep doing the thing. So doing some type of meditative or breathing exercise is good. But The one thing you don't want to do is if you can't sleep, is you don't want to flip on all the lights and flip on TV and stuff like that, because then your brain is just going to be saying, well, just get up, it's daytime. So, you know, close your eyes, you know, put an eye mask on, and just try to, you know, quiet the mind. Even if you can't get back to fully sleep, you're at least kind of letting some of the brainwave stuff cool down.
What was the device called?
Heart Math, it's about $100. They got ones that are lightning port that just plug into your phone.
It's called Heart Math.
Heart Math.
Is napping throughout the day good? And I'm saying that if I'm not getting that quality of sleep at night, if you take 2 naps, it may be a power nap, and then it may be a regular nap. Is that,
Yeah.
is that good, or is there some harm in that, or?
No, well, it's a good. It's all about timing for the most part. So napping can be good and bad depending on what your goals are for it. Yeah, some rules of, it's definitely rules of thumb on a little bit on the napping is that, you know, you don't want to be napping too late into the afternoon, evening, because you're going to mess up your sleep inertia to be able to go back to sleep again. So, you know, if you can nap before 3 o'clock, you're not going to necessarily affect the sleep coming up that evening. One idea is that you probably should not be, you know, trying to nap for more than 90 minutes, because a sleep cycle from when you go into light sleep, REM, deep, back to REM, and light sleep and wake up, you know, is about 90 minutes. You know, if you sleeping, you know, 110 minutes, you're going into your second sleep cycle. You're going to likely have a lot of sleep inertia the following night. So, you know, stick to a nap, 90 minutes or less. Yes, you can do a 20-minute power nap, you know, but again, try to avoid all the stimulants and stuff before that, so you can actually get into some deeper sleep for that power nap.
Another thing about the heart, I like to run a lot. I know, I believe, and I might be wrong, that interval running will, when I get my heart rate up, psychologically, I think that helps me when the tones go off at night. My heart jumps from 0 to whatever. Does it interval running helps when that tone go off to, as far as racing my heart, or does it?
It's just more that you're just more conditioned, you know, that, you know, you can get your, you know, peak heart rate to X, and probably on a call, you're probably getting close to X every time. So, you know, that's a good surrogate for how healthy you can be, is how well you can maintain your peak heart rate. You know, typically I recommend, you know, if you're going to monitor these things, you know, get a chest strap. They're a little bit more sensitive than any of the wrist-based heart rate monitors are when you're exercising, and go out there on a hard run or whatever you can do and see what your peak heart rate is. You don't need to go peak unless you need to go peak on a call or you're in a race. Dial it back. You need maybe 80% of your peak for a cardiac adaptation, a good benefit, and then we dial down to like 60 to 70% when you're kind of doing the slower exercise. So, you know, if you're not monitoring your heart rate, when you're pushing yourself hard, you shouldn't be able to hold a conversation. You should be somewhat breathless speaking. But then when you slow down, you want to be able to at least hold a relative conversation with somebody. All right. Well, I thank you guys for your attention again, and if you, like I said, need anything, you can find me on Instagram. You know, the chief has my phone number. You guys can call, email, whatever you'd like to do. So, thank you again.
Thank you.
Thank you.